If you're over 50 and find yourself tossing and turning night after night, you're not alone. Poor sleep feels like a trap, stealing your energy, mood, and even your health. But the truth is, most seniors don't sleep well because of avoidable habits and hidden issues. Tonight, the reasons behind those restless nights will be explained clearly, along with simple, proven steps you can take right now to finally sleep better and wake up refreshed. If better sleep means a better life for you, please like this video and subscribe for gentle, trustworthy advice made just for seniors. Share your sleep struggles or tips in the comments. Your story can help someone else rest easier too. Aging naturally brings changes to sleep patterns, making it harder for many seniors to enjoy a full, restful night. Research shows that older adults often experience lighter sleep and wake more frequently during the night. However, these natural changes are just part of the story. Pain from conditions like arthritis or chronic illnesses can interrupt sleep and make falling back asleep difficult. Medications taken for various health issues also play a significant role, as some can cause insomnia or frequent awakenings. Restless leg syndrome, a condition characterized by uncomfortable sensations and an uncontrollable urge to move the legs, affects many seniors and disrupts their sleep cycle. Understanding these factors is essential, as it empowers seniors to address the root causes of poor sleep, rather than simply accepting it as inevitable. Some doctors advise reviewing medications with a healthcare provider to identify any that might interfere with sleep. Managing pain through appropriate treatments and consulting specialists about restless leg symptoms can improve sleep quality. Recognizing these common causes is the first step toward reclaiming better rest and boosting overall health and well-being. Consuming caffeine late in the day can significantly disrupt sleep patterns, especially in seniors. Caffeine is a stimulant that blocks adenosine, a chemical that promotes sleepiness, making it harder for the brain to wind down at night. Studies have shown that even afternoon coffee can reduce total sleep time and delay the onset of deep sleep. Similarly, drinking caffeinated teas or sodas close to bedtime prolongs alertness and causes frequent awakenings during the night. Beyond caffeine, evening habits like excessive screen time also interfere with restful sleep. The blue light emitted from phones, tablets, and computers suppresses melatonin production, a hormone that signals the body to prepare for sleep. This disruption confuses the brain's internal clock or circadian rhythm, delaying the feeling of tiredness. Many doctors warn that these habits can lead to a cycle of poor sleep, increasing risks for memory problems, mood disorders, and weakened immunity. Reducing caffeine intake after midday and limiting screen exposure in the evening are effective steps to restore natural sleep rhythms. By understanding how these common habits affect the brain, seniors can take control of their sleep environment and improve their overall health and well-being. Stress and anxiety activate the body's fight or flight response, which is meant to protect from immediate danger, but can become a constant barrier to restful sleep. When the mind is filled with worry or racing thoughts, the nervous system remains on high alert, producing stress hormones like cortisol that keep the body awake. This heightened state makes it difficult to fall asleep and causes frequent awakenings throughout the night. Research has shown that chronic stress disrupts the natural sleep cycle. Reducing deep, restorative sleep phases crucial for memory, mood, and physical repair. Seniors are particularly vulnerable because stress can also worsen existing health conditions, creating a cycle where poor sleep increases anxiety, and anxiety further disrupts sleep. Learning techniques to calm the mind before bed is essential. Practices such as gentle breathing exercises, mindfulness meditation, or guided relaxation help signal the brain that it is safe to relax. Some doctors emphasize the importance of setting a consistent bedtime routine that includes calming activities to reduce nighttime stress. By managing anxiety and calming the nervous system, seniors can break the cycle of sleeplessness and improve the quality and duration of their sleep, ultimately supporting better overall health. Creating a sleep-friendly environment is essential for seniors who want to improve the quality and duration of their rest. A cool room temperature helps lower the body's core temperature, a natural signal for the brain to prepare for sleep. Studies suggest that keeping the bedroom between 60 and 67 degrees Fahrenheit can promote deeper and more restful sleep. Darkness is equally important because exposure to light inhibits the production of melatonin, the hormone responsible for regulating the sleep-wake cycle. Using blackout curtains or eye masks can block out streetlights or early morning sun, allowing the brain to fully relax. Noise control is another key factor. Even subtle sounds can interrupt sleep cycles, so reducing background noise with earplugs, white noise machines, or soft music can help maintain uninterrupted sleep. Comfortable bedding tailored to individual needs also plays a vital role. Older adults often experience joint stiffness or arthritis, making a supportive mattress and pillows crucial for reducing discomfort and promoting relaxation. Some doctors recommend memory foam or adjustable beds to alleviate pressure points and improve spinal alignment. Keeping the bedroom clutter-free and reserved only for sleep and relaxation reinforces the brain's association between the space and restful rest. By carefully adjusting these elements, seniors can create a sanctuary that supports natural, restorative sleep, which is critical for memory, mood, immune health, and overall well-being. This simple, intentional approach to the sleep environment can make a significant difference in how seniors feel each day. Gentle evening routines play a crucial role in helping the body transition from the busyness of the day into restful sleep. Light stretching is one of the simplest ways to signal relaxation, easing muscle tension and calming the nervous system. Research shows that even just a few minutes of gentle stretches can lower heart rate and reduce stress hormones, preparing the body for sleep. Warm baths are another powerful tool. The rise in body temperature from soaking in warm water is followed by a cooling effect when stepping out, which naturally encourages sleepiness. Many doctors recommend a bath about 90 minutes before bedtime to maximize this benefit. Reading a physical book or magazine, preferably something calming and not too stimulating, can also cue the brain that it's time to wind down. Avoiding screens during this time is important because the blue light they emit suppresses melatonin production, the hormone responsible for regulating sleep. Other calming activities, such as listening to soft music or practicing deep breathing, help reduce anxiety and quiet the mind. Establishing a consistent evening routine not only improves sleep quality but also enhances overall mental and physical health in seniors. Creating this calming ritual encourages the body's natural circadian rhythm to take over, making it easier to fall asleep and stay asleep through the night. For seniors, these gentle habits can make the difference between restless nights and waking up feeling refreshed and ready for the day ahead. Persistent sleep problems may signal underlying health issues that require medical attention. Conditions such as sleep apnea, chronic pain, or depression are common causes of disrupted sleep in seniors. Sleep apnea, characterized by pauses in breathing during sleep, often goes undiagnosed but can lead to serious complications like heart disease or stroke. Chronic pain from arthritis or other conditions can make it difficult to find a comfortable position, resulting in frequent awakenings. Depression is another factor that can both disrupt sleep and be worsened by poor rest. Some doctors warn that ignoring these issues can create a harmful cycle, where poor sleep worsens the underlying condition, and the condition further impairs sleep. If sleep difficulties persist despite trying common remedies, or if symptoms like loud snoring, choking during sleep, persistent pain, or feelings of sadness or hopelessness occur, it's important to consult a healthcare provider. Early diagnosis and treatment can improve sleep quality and overall well-being, making a significant difference in daily life.